December 2nd, 2020 was a day that brought the world hope.
We're packing vials of vaccine as we speak, and we'll be shipping them in the next 48 hours, the first batches to the UK.
Since the outbreak of the COVID-19 pandemic, scientists around the world have raced against time to find vaccines to protect people. Now, a number of rich countries have started a rollout of the most promising jabs, with nations like the US and UK pre-ordering a large amount.
I've just had my vaccine today and I'm going to go into work in a few hours' time. Probably the most pain-free jab I've ever had, to be honest.
But there's a problem. How do you provide fair vaccine access to people around the world? Despite pledges from some pharmaceutical companies to distribute a large share of their vaccines to developing nations, campaigners have warned that about 9 out of 10 people in low-income countries are unlikely to be immunized this year. This is partly connected to another big issue. How do you keep the vaccines at the right temperature when some poorer regions have no electricity to run cold storage? Well, one solution is off-grid clean energy. And it's an answer that could help curb climate change too. First off, we need to talk a bit more about vaccines. The vaccines from Pfizer and Moderna are RNA-derived, which means they only work if they're kept at freezing temperatures. And not the cold of your average fridge, but Arctic cold. That's at minus 20 degrees Celsius for Moderna and minus 75 degrees Celsius for Pfizer. And even the storage and transport of the Oxford AstraZeneca vaccine, which needs a less extreme 2 to 8 degrees Celsius, will still be a huge challenge for many countries. So the logistics of safely distributing vaccines around the world, from production to the patient, relies heavily on one thing: temperature control. Or more specifically, what's called a cold chain system.
A cold chain is all the pieces of equipment which move product or food or vaccines either from the farm or a factory right the way through to our fork or to our arm for a vaccine. And it's only now, with the need for mass immunization, that even the words cold chain are becoming part of daily language.
Over the past year, creating a COVID-19 vaccine has been seen as the ultimate goal. But that may be just the beginning.
The day we started designing a vaccine, we should have been designing the distribution system for the vaccine. Today, we vaccinate about 118 million children globally for childhood illnesses. Potentially here, we're looking at having to mass vaccinate 5.5 billion people to get herd immunity, and do this at a speed which has never been considered before.
To keep vaccines correctly in a cold chain requires a lot of energy, usually from electricity. But for some places in the developing world, particularly in rural areas, many health facilities struggle even to power regular fridges, let alone hospital equipment and machinery. Take Africa, for example. Almost 600 million people there are not connected to national power grids. And in sub-Saharan Africa, it's estimated that only 28% of health facilities have access to reliable electricity.
If a COVID vaccine requires cold storage, as we know the first 2 or 3 do, it will require a significant and possibly dramatic expansion of cold chains across low and middle income countries. So we need to start treating access to cooling and access to cold chains that carry vaccines as an issue of equity. It's not a luxury to be able to receive a vaccine. In this case, it can be a matter of life and death.
So what's the answer? For some communities, it's to install their own green source of power. A growing number of health facilities in India, Sierra Leone, and Zimbabwe are getting clean energy from off-grid solar energy. In Sierra Leone, the UN has worked with the private sector to install solar mini-grids that can power clinics, homes, and businesses in local communities. If they are run in a sustainable way, it can help meet a range of development goals, from health and education to food security. But solar power for vaccine cold storage is just one part of the puzzle.
Off-grid solutions like mini-grids and solar home systems are going to be crucial to bridging that gap. Solar-powered fridges are designed to maintain vaccines at the prescribed temperatures without the need for electricity from the grid. Even though the initial cost of these might be a bit higher, They offer significant energy cost savings, which reduce the costs over time, and they reduce emissions.
A lot of African nations are drawing on lessons from Rwanda too, where some urbanized areas have electrification rates of up to 72%, compared to roughly 12% in rural areas. The country has made huge progress in building efficient, climate-friendly cold chains for food and medicine delivery, even in far-flung areas. So how does it work? It's a system that revolves around one central warehouse that serves as a cooling hub for vaccines. They're then sent out to district hospitals, health centres and remote rural health posts, many of which use solar fridges. It's helped get a range of vaccines to more than 95% of the East African country's children, according to the World Health Organization, and enabled an ambitious Ebola vaccination project to stop the deadly disease spreading across the border from the DRC in 2019. The UN Children's Agency, UNICEF, and Global Vaccine Alliance, Gavi, are now working in developing countries to put in place clean energy cold chains for a COVID vaccine, including solar fridges. Experts are also looking at whether vaccine cold storage can be combined with expanding refrigeration for farmers to keep crops and processed products for longer, avoiding waste and boosting incomes. So what are the challenges that lie ahead? The first is the short time frame in which action needs to be taken. Can sustainable, clean energy cold chains be developed fast enough to roll out a COVID vaccine in the coming months?
The WHO figures suggest that in some countries you can lose as much as 25% of a vaccine due to broken cold chains. So America, UK are all telling us the size of the logistics challenge. And that's the same size and magnitude for Rwanda or Bangladesh or any country. Regardless of how good the vaccination network is for traditional vaccines, this is a completely different problem.
And then there's the question of who will pay for it. COVAX, an international partnership, and Gavi aim to deliver 1.8 billion vaccine doses to 92 middle and low-income countries in 2021. Around 600 million doses are intended to reach the African continent this year. But a number of factors can affect the fair distribution, like funding shortfalls, manufacturing capacity, and global vaccine hoarding by richer countries.
It's truly a global issue, and it won't be resolved until we have a global solution. And that global solution has taken a significant step forward in terms of the development of the vaccine, but crisis won't truly come under control from the development, poverty, social aspect of it until we are able to roll out the COVID-19 vaccine to those low and middle income countries.
The hope is that COVID-19 vaccines requiring only standard cold storage will mean rural health centres can use solar-powered refrigerators. But that will still require a big leap forward in clean energy provision for the world's poorest, and investment to make that happen. If the COVID-19 pandemic helps speed up access to green power for those communities, the benefits could be felt across the continent for decades to come.